Bill?
So Vanguard is opened its doors for a Philadelphia-based company in 1975. So we were essentially a startup with a handful of people, a couple of mutual funds, and fast forward to the present. Today we manage money for something like 25 million investors who have $2 trillion invested in 160 different funds. So there's been a lot of growth between starting in 1975 and where we are today. We are an increasingly global organization, but our roots are still very much in Philadelphia. Many of you know our campus, if you will, is out in Malvern, about 20 miles west of here. And of our 14,000 crew members, which are our term for employees, 10,000 of them are in the Philadelphia region, many out on the campus and in surrounding areas. We actually consider being here in the Philadelphia region one of our great competitive strengths. If you think about, to Rob's question, what's really on our minds right now, I would say, three big things. Besides the economy and the state of the markets, which is a whole other story, but we'll save that for during the break. Don't check your BlackBerries, you'll get depressed if you look at down. But the first thing for us is we're actually trying to take our message more globally. So we have operations now in 10 different countries, and we're trying to take our fundamental concept, which is coupling very low cost investing with a high level of, I'll call it virtual service through the web and through our phone associates and so forth. We're trying to take that story out into many, many different areas. So the whole globalization theme is upon us. The second thing for us is we have built our reputation on being the lowest cost provider of investment services in our space. And we're now actually seeing a lot of competition. We've actually, for the first time in our history, seen people try to beat us at, on price and try to actually compete in that space with us. And we're going to have to continue to bend the cost curve and at the same time enhance what we do from a service standpoint as our investors' needs grow in sophistication and so forth. So that combination of innovative ways to further take costs out of the equation while continually enhancing service is probably the second big thing. And then the third thing that we're going to work very hard on is the whole people side. And at the end of the day, if you're in a service business, how you distinguish yourself from your competition is really rooted in people. And so for us, making sure that we have the most talented individuals in our business is really front and center. It's working with organizations like John and many of the other great educational institutions in Philly. In particular, it's really helped us along that path, but we have a long way to go.
Thanks, Rob. Thanks a lot. First of all, Rocky music was great because I was a kid that grew up not far from 9th and Morton. So I grew up in South Philly, so that resonates with me quite a bit, so it was great to hear that. And I've come full circle because now I live back in the city of Philadelphia after being in New Jersey for a long time. I'll tell you a little bit about Virtua. Virtua is a healthcare provider located in southern New Jersey. We're about 15 miles east of the city of Philadelphia, in Cherry Hill, Voorhees, Marlton area of South Jersey. I wish I could say there's not a lot on my mind being a healthcare provider, but there is a lot on our minds today. And irregardless of the turnout of the election yesterday, there's a lot of change going to happen in healthcare, irregardless of the Affordable Care Act and what's going on. Virtua has 4 hospitals in southern New Jersey. We have a large home health system. We have 2 long-term care facilities. We provide paramedic services and mobile intensive care services. So we have a full range of healthcare services in the southern New Jersey region. We cover 3 counties, Burlington, Gloucester, and Camden counties, our service market. We just built a state-of-the-art $500 million hospital in Voorhees Township, right on Route 73 in Voorhees, New Jersey. And it's 1 million square feet of campus, all inclusive. So great way to build a hospital from the ground up was a very exciting venture for us. A lot going on in healthcare, and I think the key thing for healthcare providers, no matter where you're located, is how do you reinvent yourself as a healthcare provider. Number one, how do you lower your acute care cost in the hospital setting? And that's something that we have to work on because we're too expensive as as a product to the business community, to the consumer at large. So we have to be thinking about ways of reinventing ourselves and not duplicating services. We work with John, we're going to be working with John in Philadelphia, looking at partnerships in residency programs, and the education front from Drexel. What does Drexel University bring to Virtua to make us more effective and more efficient? We work with Children's Hospital of Philadelphia as a partner in Southern New Jersey. Steve Altshuler is a good partner of ours and works directly with Virtua to provide pediatric services at 2 of our hospitals in Southern New Jersey. Fox Chase Cancer Center is our cancer partner in Southern New Jersey. So the theme for us here is to really think about breaking down that river and crossing that river and developing relationships with the great institutions in Philadelphia, not to duplicate services, but to partner for those services that we need to be thinking about. The other thing we're really focused on at Virtua, and a lot of healthcare providers should be focused on, is how do we take care, how do we keep people healthy in the community? How do we cut chronic disease for the people that have chronic disease? And how do we deal with end-of-life issues in healthcare? Those are the 3 areas that we're focused on. Because if we can do those three things very well, I think we're going to cut our costs and be successful in managing the patient environment and keep people at home and try to keep them healthier at home. So my focus is I have 8,500 employees and their families that we self-insure. So my goal is to make sure that I'm taking care of their health every day through nutrition, through exercise, through vehicles that work for our employees. And then we're going to be involved with CMS in what we call an accountable care model, where we take about 11,000 Medicare beneficiaries and manage their care in a different way, where we're keeping them at home. We're providing physician services at home and other types of services to keep them out of our emergency rooms and keep them healthier at home. That model will kick off in January. So kind of that's how the process looks. We're also partnering with CVS in Southern New Jersey for mini clinics. We're going to supervise the mini clinics in Southern New Jersey, nurse practitioner model. And we're also talking to Wawa about their employees and how do we provide a healthier program and healthier nutrition program for their employees, and how do they help Virtua provide better nutrition at our location. So a lot of change in healthcare. I think it's exciting. I think there's great opportunities for healthcare providers to grow in this environment.
Great, thanks, Rich. Ladies and gentlemen, the title for the gentleman to my left, NBC News analyst and special counsel, really doesn't do justice to the vertically integrated enterprise, Edward G. Rendell, who has struck out on many fronts since serving us so well in this city, in this Commonwealth, and nationally as well. So, and to get the first question, you've heard various verticals that drive our regions and the city's economy. From your vantage point, what is the secret sauce in the next 3 to 5 years in terms of innovation, growth, and the nexus of these enterprises with government?
Well, let me begin by saying, because of the fact that I now have 16 bosses after spending about 30 years being my own boss, I won't be able to stay for the entire program. It was supposed to, the panel was supposed to be 2 to 3, and I scheduled a TV in for NBC at 3:20. So I apologize for having to leave early, very much so. I find it's very strange that when people pay you, they expect you to show up on time. something I never had to do as governor or mayor. But let me begin by saying, first of all, the great thing about innovation is there's so much room for it. I mean, if you think of just the biomedical field, the innovations that have occurred just in the past 7 or 8 years, I mean, it just seems like yesterday, but less than a decade ago, Penn came out with DNA research into DNA's ability to prevent disease from happening. And I remember listening on the radio. I was governor at the time. I think early on in my time as governor, but they announced that this research had developed and worked into entrepreneurism. And the entrepreneurs, the doctors who did this, were going up to New York's version of the Silicon Valley to start their business. And it occurred to me, this was early on, it occurred to me, it makes no sense at all we have all the great research facilities doing all the innovation here. Why do they need to go to New York? So in my first year as governor, I did a couple of things to set the table, and I think these things there's a need for action to make these things, to maximize the benefits of these things in innovation. First off, there had been a program that Governor Ridge started, similar to the Empire Zones in New York, called Keystone Opportunity Zones. They were mostly designed for brownfields. There were no tax zones, no state and local tax zones. Mostly designed to help companies come in and remediate brownfields. In return, they would get no taxes, no state and local taxes for a decade. It was a program that worked moderately well. It was a good program. But I thought about all of the innovations and the things that were going on in the Southeast and the Southwest as well. And we created a program called Keystone Innovation Zones. And unlike the Keystone Opportunity Zones, which the political subdivision had to be the applicant, here it had to be either a research institution, medical school, a hospital, a healthcare institution, or a university. And we've had, I think, 16 around the state. There is one around the University of Pennsylvania area. I asked John on the way in. I thought Drexel was a part of it, but it's possible that they weren't. But these zones are excellent for startups. First of all, the benefits that accrue from being in the zones are for startups. You have to be 70 years of age or younger to take advantage of any of the benefits. There's priority to the state's venture capital funds. There's grant money available to nurture these startups. There's all sorts of tax credits, there are tradable tax credits, because obviously startups don't make a lot of money. There's all sorts of technical support that come from these Keystone Opportunity Zones. I don't know how many of you in the audience know about the KOCs, and if you're working with a young company, it would behoove you to take a look at getting them into the geographic locations of these Keystone Innovation Zones, number one. Number two, I decided that we wanted to drive venture capital as governor, and in 2003, we put together an economic stimulus program, and we put together almost $400 billion of money to promote venture investments in Pennsylvania. $250 million of it was in a venture guarantee fund, and $150 million went out to the Ben Franklin partnerships, and some of it went directly through DCED. It was very successful. In the 2008, a venture magazine said that we were the third, for the last 4 years prior to that, we were the third highest state in the number of jobs directly created by venture investments. It's private sector and public sector venture investments. And the venture guarantee program actually did not spend all of its money. Of the $250 million in guarantee funds, only $197 million was spent. That's $53 million that's available. But I checked today with some of the guys who used to work for me that are still working for Governor Corbett, and the time has run out in the statute. So there's $53 million in guarantee money, which is extremely valuable. And all the legislature would have to do is, and Rob knows this very well, they'd have to move to amend the original law and create a new time period in which that original stimulus money could be made available for. That's something that the venture community should absolutely get behind as soon as possible. So, government, I believe, has a role in helping sponsor and both create the environment, the tax environment, to a helping hand with grants and venture capital guarantees and the like, and venture capital investments. And it's important, and I think we did that in Harrisburg, and we should continue to do it. The mayor should get tremendous credit. It doesn't sound like a lot of money that is put into these two funds, but for Philadelphia, in the state of the budget, with the control board looking down there at them, it's a very significant investment. And it's an investment. If it succeeds, the mayor will be able to get more money into that fund. So success, we get success. And my message to all of you is, one, be aware of all of these things. I don't know how many of you are aware that there is Keystone Innovation Zones all over the state. but certainly at least two, I think, in the Philadelphia area. And two, let's get together as a group, and maybe the chamber could lead this effort to get the time period on the venture guarantee fund extended for another 5 or 10 years. That would be terrific.
Great. By the way, I voted yes to this in a 3.
There you go.
So, interesting.
Bipartisanship.
Exactly. Interesting in the introductions, John, Bill, and Rich all talked about partnerships and the virtual Drexel partnership, workforce partnership at Vanguard with the crew back at Drexel University. In leadership roles, and you were constantly thinking about innovation, what does the structure of a partnership look like? What are the elements of that partnership that may be different now than, say, 5, 10 years ago, due to globalization, the velocity of move at a much faster pace? Is there a changing dynamic as opposed to sort of the last century public-private partnership or rigorous frameworks for such relationships? Rich, John?
Well, I mean, I think from a healthcare perspective, Rob, its cost is the driver. Frankly, we're a hospital system, so we don't need to reinvent ourselves in the education front. You know, that's where John comes into play at Drexel and can provide the education components that maybe virtually doesn't have right now. So you look for those relationships to fill gaps and to grow your business model effectively. So I mean that's the important piece in healthcare today is not add more cost and more structure to a healthcare structure that's burdened with that right now. So the key is find potential good partners. I think the other thing that makes it work in all of our relationships is the leadership at the other side of the table and making sure the leader can create a win-win situation for both partners. And when we sit across the table, it has to be someone that we feel shares our values and shares the culture of our organization to build that partnership. So we're looking for that relationship. And in all of our relationships, especially as we deal with Fox Chase and we deal with CHOP, we have that relationship where, for example, our kids in New Jersey stay home for services in our hospitals, but also we've increased CHOP's business by transfer. They have an increase of 14% in their business from Southern New Jersey. For kids that we can treat, it's a great partnership and it works out well, and that's the win-win in that relationship. So again, not duplicating things, not adding a cost tier, and finding the right player that works well with your organization to create a win-win.
Great. So Rob, I'd say that I think these partnerships are becoming more consequential and more long-term, and therefore you really need strong alignment. So I think of sort of two kinds of partnerships we're involved with right now. One actually turned into an outright merger with the Academy of National Sciences. And I think whereas in the past, you could see those kind of partnerships, between nonprofit organizations, and they pick a project and they do it together. Now we're in a sort of a sector consolidation mode, and I think we're going to see more of these types of mergers and other permanent partnerships forming, because small organizations that have a lot of value cannot stand on their own much longer. And they're going to be looking for large organizations where there's a niche to be filled, and they're going to come together. I think we're going to see some very new organizational forms, coming up in the future. The second thing on the development side, probably about $200 million of our capital will be done in conjunction with third-party private developers, mostly around the area of residences, but I can see this actually becoming commercial as well. Those are 70, 80-year relationships that really have to be built right from the beginning and have great consequence because so much money is being spent. And so I think that's another form of partnership that has, a big reward but a big risk if it doesn't go well.